Badriya Yuya learns that one of her 8-month-old twins, Hahumati Shamsadin, is severely underweight during the monthly community growth monitoring and promotion sessions conducted by volunteer community health worker and health development army member Qasim Jobiraw in Janjo village, Qabso Takoma Qabale, in drought-affected eastern Ethiopia. Monthly community growth monitoring and promotion of children 2 years and younger is one of the pillars of the UNICEF-supported community-based nutrition program that was introduced by the government of Ethiopia in 2008 in drought-prone and food-insecure districts like Deder. The Community-Based Nutrition Program, or CBN, is designed to empower the community to assess the nutritional status of their children, analyze why things may not be as they should, and take action using their own resources to prevent malnutrition and promote the well-being of their children. Tracking the growth of all children in the community enables the timely identification and referral for further examination and treatment of severely underweight children like Hahumati. Badriya heeds the advice of the volunteer community health workers and takes baby Hahumati to the Qabso Takoma health post for further screening. Tigist Imabir, one of the 2 health extension workers assigned to the Qabso Takoma health post, has received UNICEF-supported training on outpatient therapeutic feeding and welcomes Badriya to the weekly program. Tigist measures Hahumati's mid-upper arm circumference, an indicator of nutritional status, and records 9 centimeters, well below the 11 centimeter mark that indicates severe acute malnutrition in children 5 years and younger. It's a condition that can be deadly if untreated. Tigist then weighs Hahumati and registers his weight, 4 kilograms, on his outpatient therapeutic feeding program admission card. She'll be monitoring his weight every week until he reaches a point when he is out of danger, no longer severely malnourished, and can be discharged. Tigist also checks his temperature to ensure he does not have fever, as well as his breathing pattern for signs of pneumonia, both complications that would require clinical care. Finally, Tigist helps Badriya to wash her hands and leads mother and child to a quiet corner with a sachet of ready-to-use therapeutic food for the appetite test. This is Hahumati's first time tasting the food, but he needs no coaxing to eat the sweet, peanut butter-like paste. Hahumati has passed all criteria for entering the outpatient program, and Tigist ends his first session by giving Badriya a week's supply of ready-to-use therapeutic food and a bottle of amoxicillin antibiotics to treat any infections with instructions on how to administer it.
በአሁኑ ሰዓት አሁን 10 ህጻናቶች አሉን ኦቲፒ ውስጥ የዛሬ አመት በርግጥ በዚህ ሰላይ ብዙ ጊዜ ይጨምራል በየአመቱ ወቅቱም የምግብ ስለሌለ ቤት ውስጥ ቢያቃሉ ግንዛቤ ቢኖራቸውም ስለማይኖራቸው የሚያብሉ ነገር ስለሌላቸው ይጎዱባቸዋል በምግብ እጥረት ከወቅቱ ጋር ተያይዞ ማለት ነው።
In 2011, a combination of drought, poor harvest from the previous year, and rising food prices has resulted in more than 4.5 million Ethiopians requiring emergency food assistance. The delayed rainy season in areas like Deder is compounding the impact of the lean between harvests season when malnutrition rates generally rise. For Badriya, the impact has been double as she's been struggling to manage with twins.
garu gafasis rise ga na rukbeti nanis dale qanafu harmi khiyaqun bua qanno fi dawa falli gas geise je duru harmama bicha loisis amma ga ege je laman boda kana tayajila ga anga dandauti wan mamana khayse jirulle kana ma wali gode taqannu qara harma kana nara ankachu dandeise qara harma faqoslalu idulama dawarte lama tilu gudimi khanana raw furachu dindise ankena khanana rafidachu dindise.
The government of Ethiopia estimates that over 150,000 children under the age of 5 will require treatment for severe acute malnutrition through the end of 2011. The community-based nutrition and outpatient therapeutic feeding programs are ensuring that severely malnourished children are identified early and treatment provided near their homes. These UNICEF-supported government systems are responding to the needs of malnourished children, ensuring that they have a strong chance of recovering and surviving the worst impact of the drought. UNICEF has supported Ethiopia to increase national capacity to treat severe acute malnutrition in drought and food insecure districts like Deder from almost nothing in 2003 to more than 8,700 sites today throughout Ethiopia. UNICEF has supported the Ministry and Regional Bureaus of Health to train health extension workers like Tigist in outpatient therapeutic feeding. UNICEF also provides the ready-to-use therapeutic foods, nutritional supplements, medicines, and other inputs such as weighing scales and measuring tapes that are required for the program. UNICEF monitors the performance of programs jointly while building the capacity of local managers and supervisors.
ያው ደስተኛ ነኝ ህፃናቶችን ልክ እንደ ራሴ ልጆች አይቼ በመንከባከቤ ትልቅ ደስታ ነው የሚሰማኝ ኦቲፒም ሲመጡ ልክ እንደ ራሴ እንደ ልጄ ነው ማያቸው ከዛ ጽዳት ከሌላቸውም ጽዳታቸውን እንዲጠብቁ መክራቸዋለሁ እንዴት እንደሚመገቡ እንደ ሌላ ሳይሆን ልክ እንደ ልጆቼ ያያየው ስለምላቸው ስለምመክራቸው ደስ ይለኛል